Happy Monday, everyone, and welcome to tonight's Facebook Live. So we do Facebook Lives every Monday night, and I guess I should probably start dating these just in case. I don't know. So I know a lot of people, especially many of my international Facebook friends and many of the Andy facilities that check this out later, watch it. Are in a different time zone in a different country. So tonight is Monday, February 19th. Again, we do Facebook Lives every Monday night. My name is Laura Betts. I am facility director here at Hyperbarics RX, and it is always great having you here. As always, this information is for general information purposes. It's not regarded as a substitute for advice of a licensed physician. And of course, any products that we're discussing here, we're talking generally, they're not intended to treat, cure, diagnose, or prevent any disease. So last week we talked about what to expect from a single hyperbaric session. And this week's tonight topic, we're going to talk about the benefits of hyperbaric preconditioning for cosmetic surgery. So before I go further, let me just finish a couple of introductions here. Our facility, Hyperbarics RX, we're located here in Fort Lauderdale, Florida. And one of the referrals that we get all the time is for people after they've had a complication from an elective surgical procedure. So this could be from a tummy tuck, this could be from a breast enhancement, this could be from a facelift, this can be from a variety of different procedures. And what can happen is essentially for a long list of reasons, sometimes because these procedures are very complicated and the person might not have been an ideal candidate to begin with. I mean, let's be honest, we're not all in the best optimal state of health. There's always another level for us to be. And if we're not in a great state of health, if we're really out of physical shape, and then we go and do a surgical procedure, well, that translates to how we can heal. And sometimes there are unexpected complications from the procedures. So what'll happen is essentially on a surgical follow-up, basically the wound isn't healing right. And sometimes by the time they get to us, it's been a week, a couple weeks post-surgical, and the tissue will actually start to go black. The fancy term for that is necrotize. That is not good. That means that we have essentially tissue that doesn't have enough oxygen to keep it alive. It's dying. It's becoming necrotic. And the problem with necrotic tissue, in addition to the fact that we have an area of the body that isn't healing, that isn't healthy, that essentially is rotting as a consequence of the dying tissue, we ultimately end up with bacterial issues. And there's a bigger picture here because if the bacteria were to move out of the tissue into the bloodstream, the term for that is going septic. We're concerned about sepsis. And a bacterial infection in the blood is a very big deal. It's life-threatening, and decisions have to be made to prevent that. And that's one of the reasons why hyperbaric is used to help heal wounds and prevent amputations. And when amputations are necessary, the reason why they do the amputation is ultimately because of the concern of sepsis and ultimately it not working out so well for the individual. So, and if you're in this situation, by the way, if you're listening to this right now, or you're hearing it on the replay, and you're post-surgical from a cosmetic procedure, and you're not healing well, you're in a lot of pain, or how about you just like to heal faster with less complications? We'd love to have you give us a call. Again, we're located here in Fort Lauderdale, Florida. We are an Andy certified hyperbaric facility, and just give us a ring. We have certified hyperbaric chamber operators on staff. And if you're planning a surgical procedure, which is really what I'm going to talk about tonight, you really want to get hyperbaric before your surgical procedure, your cosmetic procedure, and you want to do the post-surgical. The whole point of the procedure is how it heals. And one of the most amazing things about wound care, one of the most amazing things that you actually get to see the wound heal. So the edges of the wound, the borders, after a single hyperbaric session, you can see granulization. That's the body making new tissue. The borders crisp up. The body is healing faster. And in general, tissue repairs about 80% faster under clinical hyperbaric. Now, that is dosage dependent, by the way. And I do want to make the point that this is another reason why you want to come to an ANDI certified hyperbaric facility. A lot of the things that I talk about in my Facebook Lives are related to specific target dosages. And that's one of the benefits of having a certified chamber operator administering your hyperbaric session. They're able to duplicate the required target pressure necessary for the protocol. So when I'm talking about some of these mechanisms, I am specifically referencing the proper ANDI protocol, the proper target dosage, the proper clinical dosage, treating at a significantly lower dosage, especially with what we're talking about here, while it does to some extent in continue to improve healing. Yes, we do technically heal faster, even at lower hyperbaric dosages. These big wows and some of these super fast responses, you wouldn't get them at a lower dosage. So again, if you're listening to this and maybe you did hyperbaric and you said, wow, I didn't think it made that much of a difference at all, it's probably because the dosage was not the proper target dosage for the goal of the particular protocol. So again, bringing back to this. So we're talking about clinical hyperbaric dosages here. And again, getting back to those borders, so you can actually see the edges crisp. And one of the neat benefits of those edges crisping up is there is significantly less scarring. The cleaner the edges, the cleaner the borders, the better the tissue knits, the better the wound heals. So this is a neat benefit of hyperbaric oxygen therapy on the post-surgical side. This is one of the reasons why it's used in wound care, and this is one of the reasons why many people use it as a part of their elective procedure. Now, the benefits on the post-surgical side, some of them like reduction of pain and enhanced healing and reduction of inflammation. Well, what if we were able to engage them before? And this is where hyperbaric preconditioning comes in. Now, again, we all have ancillary exposure, right? We're walking around, we're outside, we're meeting people, we're eating things, we're coming in contact with things, things are coming in contact with us, we're inhaling things. And all of these things potentially create an opportunity to negatively affect the immune system. And it's possible that we could be coming down with something prior to our surgical procedure that we didn't know about. So one of the neat benefits of pre-surgical conditioning is the hyperbaric oxygen works like a broad spectrum bactericide. It has some virucidal properties. It even has oncocidal properties. It's destructive to certain types of cancer cells. And this broad spectrum bactericidal effect, as I've talked about in some other videos, neat thing, it doesn't hurt the good gut bacteria. So while you couldn't use an antibiotic prophylactically, right? You couldn't say, oh, I think I might have an infection, because the antibiotic doesn't just kill bad guys, it kills good guys too. And if we kill the good guys too much, then there's nobody to fight the bad guys. And this is part of how the immune system, the gut, becomes so out of balance. So that's not the goal here. But hyperbaric is a neutral for the good guys. So as part of pre-surgical conditioning for a cosmetic procedure, for an elective procedure, we're going ahead and killing bacteria, killing things that isn't supposed to be there. And at the same time, we're supercharging the white blood cell, making it better hunter with bigger guns. So cleaning things up and preparing. Another benefit of pre-surgical conditioning is we all have some kind of ancillary inflammation. So being able to not just bring down the mild chronic inflammation that we tend to deal with. I mean, again, certain foods are inflammatory, things we come in contact. The inflammatory mechanism is part of how the body mobilizes resources from one part to another, mobilizes resources to an area to accomplish something. And this chronic inflammation, when we're talking again about an elective procedure, well, how it heals, how those edges heal when there is more inflammation present, it affects not only how quickly it heals, but how cleanly it heals and if there is scarring. So by doing pre-surgical conditioning, we're going ahead and taking down any mild chronic inflammation that is present. And it prepares the body to be able to be more ready for the surgical procedure. The other point is the body is already bringing down the inflammatory cycle, so that when the healing mechanisms kick in after the surgery and the body starts to, the surgical site is going to become inflamed post-surgery. We've already started healthy, positive anti-inflammatory mechanisms. So the post-surgical swelling, the post-surgical inflammation can be reduced, in some cases pretty significantly, by the preconditioning side. Now, again, the post-surgical pain is directly related to the amount of inflammation. So the less inflammation we have, the less discomfort, the less pain that we're going to be in. Now, another neat thing about hyperbaric oxygen therapy is it's clinically documented to have an analgesic benefit. And that pain reducing benefit is because of a few different reasons. It not only reduces pain by bringing down swelling and inflammation in the area, but the neurotransmitter, the pain receptor, clinically documented to be downregulated in some cases for almost 3 weeks after a hyperbaric session. So the pain tolerance is going to be better simply because we had hyperbaric preconditioning. Now, that in itself is a really big deal. What we see here post-surgically, and when we hear it all the time, many people had no idea what the post-surgical recovery was going to be. These are, in many cases, younger people. They haven't had a surgical procedure before, and this is the first time they're having any significant surgery, and it can be a bit of a shock. Not expected how much discomfort, not expected the level of pain that there would be. We hear all the time, if I would have known there were going to be all these issues, I'm not sure I would have done it. At the same point, we get to hear the really neat stories of the people who do the hyperbaric as a pre and post-surgical adjuvant, and they just do it automatically. And they come in and they go, look how quickly I'm healing, and my doctor is so happy, and I'm not in pain, and I'm already ready to go back to work. And I know that's not time yet, so I'm trying not to do too much, but I feel so great. And it's just a matter of creating the opportunity to help support the body's healing mechanisms. Now, again, one of the other things that hyperbaric oxygen therapy does is it mobilizes stem cells. So this is another area with the conditioning for cosmetic surgery benefit that really helps to supercharge the healing mechanisms before the procedure. So the body is already in a regenerative process. The body is already, the term for the growth of new bone and tissue is angiogenesis. And we've already kicked off the switch. We've turned on the switches that initiate the angiogenesis. The body's already in a healing and repair cycle. So it creates an opportunity again for better success on the post-surgical side. And as if the rapid healing wasn't enough and the reduction of inflammation wasn't enough, let me go ahead and again remind about the bactericidal mechanisms. One of the biggest problems with surgical procedures in general, and the most common complication is post-surgical infection. And certain types of cosmetic surgery are much higher risk for infection than others, but there is always a significant risk, and the more invasive the procedure, the more probable for infection. Now, this is one of the reasons why very often the person is on antibiotics, but a lot of these critters are antibiotic resistant, and the antibiotic is assuming that it is matched for the type of bacteria, and you can get something that the broad spectrum isn't able to cover. So again, this is where on the front side, the hyperbaric is super beneficial here because we're able to go ahead and supercharge the immune system at the same time while killing bacteria. And this puts us in a better space on the post-surgical side. It actually works adjuvantly. It supercharges the antibiotic. What you see is you get the benefits from the antibiotic here. Hyperbaric's bactericidal mechanisms are here. And when the two of them are used, they work very synergistically together. And there's a lot of published research on hyperbaric for infectious diseases that goes along that way. So hyperbaric surgical preconditioning, again, not as well known, but a very, very beneficial application to consider. And if you're listening to this either on the replay or on the live stream, I would say that this is something to go ahead and schedule in advance. You know, sometimes we'll have a phone call, they'll come in and they're trying to get in for hyperbaric same day. Well, it's probably wasn't that surgical procedure probably wasn't scheduled the same day. The surgical procedure was probably on the schedule for weeks, if not months, beforehand. So we encourage you to reach out to us and schedule your hyperbaric preconditioning, followed by your post-surgical recovery, along with your appointment schedule. That way we can make sure you get your preferred appointment time. We can give any education that's necessary. And then the other thing that's neat about the preconditioning is you're not doing your first hyperbaric session coming out of a surgical procedure. It's a lot of new all at once. And if we have the opportunity to experience the hyperbaric without all of the added complications of just coming out of surgery, it does make it a little bit easier to acclimate to pressure as well. So another benefit to doing the preconditioning, even if you're thinking about doing a full block on the other side, on the post side of a surgical procedure, it's still good to do one or two sessions beforehand. And the last point that I want to make is giving an understanding of just how many hyperbaric sessions we need to do here, and part of the ways to use some of this information. So by the time there's been complications, we now need to be aggressive with the hyperbaric oxygen therapy. The tissue does not have the ability to get oxygen to it through normal channels. The blood supply, the circulation to the tissue has been compromised, hence the reason why the tissue is discoloring, why it's necrotizing, and why we need the hyperbaric oxygen therapy in the first place. So because of that, at that point, once we're in that situation, now the hyperbaric needs to be done daily. And the reason for that is because the hyperbaric session is what's reoxygenating the tissue. And if the hyperbaric sessions are done too far apart, then the tissue becomes re-deprived of oxygen, the cells aren't able to stay alive, and essentially it doesn't stop the necrotizing tissue, and ultimately it turns into an infection. So the idea as well of doing the pre-surgical conditioning followed by post-surgical recovery is that it doesn't become an emergency. It doesn't become a situation where missing a day on the protocol puts the wound in jeopardy. It creates an opportunity to just overall improve the outcome. And on the nutrition side, if we know that this is coming up, then maybe we want to do a detox before this happens to make sure that nothing is interfering in our healing mechanisms, to make sure that our mitochondria really are functioning properly. I'm sure some of the cases that we get here, part of the reason why they weren't feeling well is because they had other factors that were interfering in the body's ability to heal the wound, to repair the tissue, and ultimately that's because of some kind of mitochondria damage. So I hope this information was helpful. I hope it gave you some insight into a lesser known but arguably significant beneficial way to use hyperbaric oxygen therapy to help improve cosmetic surgery outcomes. And we look forward to seeing you on our Monday Night Live. We do we do Facebook Lives every Monday night. And we also have an opportunity for to ask us questions live in the chat with our oxygen experts and holistic health practitioners. Again, my name is Laura Betts. And if you are struggling, if you have symptoms, if you're looking to improve your life, if you have questions, please, please, please reach out to us. We would love for you to let us help you. And whether you're looking to take your health to the next level or recover from a chronic condition, we have a lot of different ways to personalize a program for you and help you meet your goals. So again, thank you so much for coming out and joining me this evening. And I look forward to seeing you on another Monday Night Facebook Live. Again, Laura Betts with Hyperbarics RX. Have a great night, everybody.